Hello, and welcome to another special guest episode of Ending Physician Overwhelm. I am thrilled to be joined again by one of my past guests, and we were just reflecting, it's been almost 2 years since we're on the program, but Dr. LaToya Lucis-Sampson, welcome back.
Thank you so much. I'm so excited to be here. Yeah, I was surprised when I look back and it was 2022. Oh my gosh, where has the time gone?
Where is the time gone and what has happened in that time, right? Yeah. And, last time when we spoke, we were having a conversation about your experience as an OBGYN in a large health system, and as an employed physician and all the challenges that come with that. But today, I'm so excited that we get a chance to talk about the difficulties that we encounter as women physician mothers. And kind of how that relates to also some unique challenges, as working women. And you have been gaining expertise and now helping our community. So I say thank you. I wish you were there years ago. But let's talk a little bit, because something major has happened in your life since you were last on the show a little over 2 years ago. Tell us about your experience.
Yes. So for those who don't know, I am LaToya Lucis-Sampson. I am originally from Trinidad and Tobago. I went to school at the wonderful Howard University, trained as an OBGYN, and now I live and work in Northern California. And when I was on previously, as Dr. Megan mentioned, I worked in a very large health system and had my second burnout at that time. The first was during residency. And then I left and was doing independent contracting. And then I got pregnant and then have since had my baby, which was all planned. But, it was a challenging time. I had a very painful pregnancy. She was very big from the beginning, and she still is big. So there was a lot of hip coccyx pain. I actually had to stop working earlier, which was good because I worked for myself. And then I had her with no complications. That was a blessing. But postpartum, I kind of was not taking care of myself. And I went right back into all of the work that I was doing that entrepreneurship enabled me to do. So I was doing social media, my education, my advocacy, all of those things that were really near and dear to my heart. But it was too much too soon. And on the back end, I was still in pain because those pains will just go away when you have the baby. I was resentful that nobody in my house was taking care of me like I thought I should have been taken care of. And I was just exhausted. Right. And eventually I hit a wall, and it was about 3 months postpartum, and I had to cancel engagements. There was a webinar that I was scheduled to do a week in advance, and I had to tell them, sorry, I can't make it. And I sat down with my husband and I was like, yeah, I need a break, and I'm going to go and take a trip by myself. Y'all be cool. I will be back. And he was like, what? So he had no idea because, of course, I was having all of these feelings and not telling anyone. So we ended up taking that trip together so that we could reconnect and figure things out. My sister came from Trinidad to help my mom, who was here at the time, take care of my kids. And that's when things kind of started to turn around. And I really started to take care of myself and realize that being angry and resentful about the way that people should take care of me is a fool's errand, right? I can't worry about what others should do, especially when I'm not even providing the correct example. So
it's that age-old sort of issue that comes up for us over and over again, that we are the caretakers. We make our work look easy. We make it seem as though, we live and breathe to take care of others.
Yeah.
We're very, very good at hiding how we feel emotionally and physically.
Yeah.
Right.
Yeah.
You probably, I don't know if you were still doing surgeries, during your pregnancy or doing deliveries, but I imagine that you were, right? Standing there in pain, in belly, back hurting, right? Probably.
Right.
And you're still expected to be an amazing surgeon, right? And you're your competency is still out there on the line in a way that we just don't see that challenge. There's not kind of a common experience, I think,
Yeah.
or that we could compare it to in men or non-pregnant people, right?
Yeah.
Not to say that everybody should be childbearing, because of course I don't think either one of us think that that's true. But we aren't let off the hook, and we aren't telling people we need help.
Yeah.
We're just assuming they should know.
Yes. That's it though. It's like you think to yourself, how could you not know? Don't you
Right.
see me?
Can't you feel my pain?
Like, I mean, yeah. So and I think it's very common for women to just assume that everybody thinks the way that we do. And if
Mhm.
I am seeing this problem, everybody should be seeing it. And if you don't comment or change your behavior, it's because you are choosing not to because you see it.
Right.
Instead, it's probably that they didn't even know what was
Right.
going on.
Right. And it's funny, it makes me think, normal humans, might stop working sooner. They might
Yeah.
stay or they might speak up.
Yeah.
But, our special breed of human, we were taught to push through, right? And we do. And of course, sometimes from an evolutionary perspective, right, that's 100% necessary. And certainly was fostered in us during our training, actually be sort of superhuman all along the way.
Yep.
But if we step back from that, it makes total sense, right? That no one knew how much you were struggling physically, emotionally.
Yeah.
Yeah.
Especially because I had started doing all these things, I went back to quote unquote normal life.
Right.
So yeah, she's
You
good.
okay? Okay. So, you kind of hit this breaking point, and you and your husband ended up going away together and thankfully, had support. Tell me sort of what happened after that. Of course, it's not the end of the story.
It is not. And I thought it
Never
was.
is.
I thought it was. So I got in with my pelvic floor physical therapist, which was life changing. She really helped me. And a lot of what I needed was time, but I got guidance on how to make that time less painful.
Mm.
And I made sure that I was sleeping. I got myself a psychotherapist. Like I started doing all the things and I completely disconnected from the social media and all the other things that were just not the priority at that time. And that's when my focus started to shift in what I was doing. And I said, I really want to focus on the postpartum period with my care and the things that I do. And like you said, I thought that I was good. It turns out I was not. So, some of the anxiety, thoughts, and feelings persisted, and it was a work in progress. And I think I'm glad that I started off with my therapist at that time. I was able to continue with her and continue working and seeing what worked for me. And, it's a work in progress. My daughter was 3 months when all this started. At 8 months, I had different challenges. I had to deal with the breastfeeding, and that was a big issue for me with this postpartum period. So it was ongoing, but I knew what I needed to do in that time to make sure that I was okay. So it wasn't perfect, but it was way better than anything I was going through before.
And that's such an important part of the story that we don't often hear. We hear a lot about the breaking point.
Yeah.
Right. And we, often see pretty pictures of the recovered state. Right.
Yeah.
But there's a lot of messiness in the middle.
Mhm.
And you never come home from that trip or that break from work or, whatever that sort of event is, and you're magically fixed. Like that isn't how humans operate,
Yeah.
including us, including these habits they have of not tuning into our needs, not speaking up about our needs, not getting the help that we need or deserve.
Yeah.
Talk to us a little bit about, any drama that you might have had around, getting a therapist or working with the pelvic floor PT when you are an OBGYN, you're supposed to know all of these things. Because I'm sure that there can be components of that too.
Yeah, so for some OBGYNs, but I am actually very pro public floor physical therapist. And, it's something that I am glad is becoming more popular in the United States at this time. People are talking more about it because in other countries it is a staple after you've had a baby. So I really valued the pelvic floor PT that I saw. And she came highly recommended for my colleagues actually at the place that I used to work at. And she really helped me, and it's something that we don't get trained on as
No.
OBGYNs. Yeah, so I'm a big advocate for letting experts do their expert thing. So, while there was some things that I did on my own, it was definitely not. There was so many things that she helped me with. She gave me like a TENS unit and very, very specific exercises to use and things that I just would have never known on my own. So I really, really appreciated that part of it. And as far as the therapist, we had done marriage therapy in the past, but I never had a personal therapist. So, well, that's not true. The marriage therapist also did solos for me at some point. It was so I can get my insurance to cover it. So I had like a couple sessions. So that was kind of a new thing for me and trying to find somebody that fit. It was important. It was important enough that I didn't give up because the first person that I found was not a good fit. And I think it could have been very easy to be like, oh, it's over. It's done. I can't find anybody. Woe is me.
Right. That's why I'm not a person for therapy.
Exactly. Yeah. So I made sure that I kept looking, and I actually put myself on medication. I don't know if I should be admitting this on a podcast.
Too late.
Right. I didn't prescribe it myself. But, as physicians, we can work the system, right? So I was able to get myself prescribed very legitimately through my OB, my medication, because I knew that I needed help. And I knew that this was something that was okay. It was potentially short term. And if it can help me get over this hump that I want to try. I didn't like it. And I know I didn't give it enough time. But in this whole journey, I was exploring other things that were, more holistic. So meditation and exercise and things like that. And those things were working better than the medication. So then I ended up stopping it. But I mentioned the medication to say it's a trap that we can fall into as physicians with self-treating, right? Because I should not have done any of those things, but I took it upon myself.
Yes, and sometimes I think we interpret getting put on in medications, whatever route we go to, right? We can interpret that as being enough. And even if the medication was a good fit for you, like that is not self-care. That is not the same thing as getting, exercise, good nutrition, right? The proper supports, all of those things are still important. It's the same conversation that is going on in my obesity medicine treatment world, right? We've got these amazing new drugs. And the basics still matter. The basics are still important.
Yeah.
Because I think it's important to highlight, if we have postpartum depression as physicians, yes, medications are important, but yes, also therapy support, more help at home, like all of those things are critical.
Yes. And there's something that you said that I wanted to touch on is that I didn't have postpartum depression. It was postpartum anxiety. And I feel like a lot of people, because it's not talked about, they say, well, I'm not depressed. So how I'm feeling isn't okay, but I'm not depressed. So it's fine.
Yeah.
There are so many other things you can be postpartum. You can be anxious. You can have OCD. You can have all of these things. So if you don't feel right, get that explored because you can be just suffering for no reason.
Yeah.
So
thank you.
Yeah.
Well, we talked a little bit before we started recording too about, some of the challenges that physicians face, especially with employed, being an employed physician. you and I now both, have our own businesses. We work as independent contractors. We have a different set of challenges, but talk to us a little bit about some of the issues that you see in physician women who are employed, because it's a different set, right? If you had still been employed, you probably would not have had the same flexibility to be able to say, I'm done, and I'm in too much pain. That had other consequences, I'm sure, financially and kind of stress wise. But talk to us a little bit about what you see.
Yeah. So it was what I was experiencing while I was there, because I had a baby while I was employed.
Mhm.
And you're right. I would have had to, work the system to try to get off earlier, but it would have had more consequences then, because that means I would get less time off after, because you have to ration your time and, do all these things. So for the first one, luckily it's my first pregnancy, and I was able to continue working for up until, I had my California leave. But with the second, my plan originally had been to get pregnant and have her, and then use all of my maternity leave and then just not go back. So I was at, one of the benefits of being at a large corporate medical place is that you get good benefits. That's how they keep you. So
Part of our golden handcuffs.
exactly. I was at the point in my career there where I would have been able to take like 6 months off, and it would have been paid. So my goal was to get pregnant. Just if I could just push through and just get pregnant and then just have the baby, and then I'll have all this paid time off, and then I'll tell them I'm not coming back. And, I couldn't even make it to do that. I was so burnt out. I was so unhappy. But just think about the people who didn't have the benefit of entrepreneurship to just leave without a plan, without a next job, right? They would have stayed, right? They would have continued to hold on in this toxic environment because, I need the insurance for the baby. I need the benefits for my family. All of these things. So it's like it has a hold on you.
Mhm.
And there's really you feel like there's nothing you can do about it.
Right. It's a, I don't want to use like prison jail, kind of terminology, right? Gold handcuff, and people may say, well, yeah, but you're lucky to have a job. And that's true to some extent. Like, of course, there's benefits, and we're highly paid relative to other, other professions, but there's a lot of costs too.
A lot.
And it's difficult to navigate some of those things. And I certainly see, struggle, with that. And I've, seen colleagues had to go on bed rest and a number of things. And the leaves thing is real, and the benefits things are real. And we don't always get that. I mean, that can be a woman's first experience, right? With sort of medicine not letting you back in a very tangible way.
Yeah.
Needing extra time off and not being able to get it.
Yeah. And then you have the baby, you have your time. If you're a resident, you may not have much time at all. But if you're employed, you have, say, a couple months, and then you have to deal with that transition back to work, where it's a place you may not want to go back to. You may be literally dreading it, going back there. And then are they going to accommodate you if you are pumping? Like all of these added things. Are you going to get out on time to see the baby? Like there's so many things that continue to be an issue in the container of this place that was burning you out and you didn't want to be in anyway. So it is tough.
Yeah. And you've pivoted into supporting women who are transitioning, back to work. They're in postpartum, or they have young children, and they're navigating that space of, being a physician, being a mom, plus or minus breastfeeding, or, older kids going on. What are you seeing, and what are you doing to help support those women? Because it's certainly an underserved population who feels double pressure, right? Because we're not doing the mom thing well enough, and we're not doing the doctor thing well enough. The struggle is real.
It is so real. And, the best ideas and businesses and, missions in life come from your own personal experience. So I really just wanted to help other women physicians just not have to go through what I went through, or at least to have somebody that can guide them and, point out things that you may not necessarily see. Just learn from my experiences, because I'm always like, don't do what I did. Don't, like, you can have it better than I did. And two, though I'm not practicing obstetrics, I have been taking care of postpartum women for like over a decade. And that postpartum visit was always like one of my favorite visits, because I like to make sure that moms were okay. And at that employed position, I was lucky enough to have, a psychologist right there. She was dedicated to us. So at that visit, I would go, get her. I'm one of those OBs where I really check your screening. Like, I'm not just like, oh, okay, cool, you're depressed, bye. So it was always, yeah, this period and making sure that moms are well has always been important to me. And I think through my experience, I feel even more conviction in that, and really just trying to revolutionize this thinking that, we can put ourselves first and it's okay. And it's actually beneficial to our families to do that. And that's really my core message. Of course, talk about other things as well: outsourcing, getting all the help, your family, your village, the mental health support. But it all centers around moms being okay, being happy and healthy, joyful and confident, so that then you can pour into your family from a full cup.
Yeah. When I imagine for not just employed physicians, but for any, physician, and of course, other women, let's just say,
Yes.
any birthing person, right?
Yeah.
Those things are really crucial, but, sort of being able to reclaim your agency is so important for us as physicians, I think,
Yes.
coming out of training, right? No one hands us, back our agency and back our ability to, feel like we have any control.
Yeah.
And it sounds like that's part of what you're doing, is really emphasizing not only is that important, but it's also good for everyone.
Yes.
When mom is well, not just when her boobs are working, not just when she's, getting some sleep or,
Right.
able to stand and cook or what, like whatever,
Right.
but she is well.
Yes. And not just well, but fulfilled. So a lot of what I see and what society tells us is that mom should get lost in motherhood. Like, you should give completely of yourself for these children up until they leave the house. I'm like, that's 18 years, people. What are we doing here? So, really knowing who you are and feeding and nourishing and loving that person, I think is very, very important. And that's, where you talk about the agency, who are you apart from being a mother? And is that person getting the care and the time that it needs, so that you feel good about yourself and you know who you are? I think it's really important. And it's not just important, it is essential, in my opinion.
Oh, just wishing we could go back in time and we could, have you be there for me and you and just about every other mom physician. Yeah. Is there anything else? So for the women who are listening, for the physicians who have young children in particular, or when they've recently had a baby and they're listening to our conversation, what do you think is the most important thing that you want them to know right now?
To take time for yourself. And that could look a couple different ways. Self-care is like a buzzword now, but I really mean it. And when I say self-care, taking a shower is not self-care. It is great if you can do it. I'm happy for you that you have the time to do it, but that does not count. Like, actual time alone, just so that you can be not touched. Nobody needs anything from you. You are just existing for yourself. That time, it is very important for your mental, physical health. And if you do nothing else, just do that. You can start small with 5 minutes alone in your room with a sign on the door saying do not disturb, and then work yourself up to a weekend away in a hotel somewhere, just with your thoughts. I don't expect you to get there right away, but just being alone with your thoughts and, seeing who am I? Am I happy? Am I okay? Because you also need that time to assess like how you're feeling, right? A lot of times don't even have time to figure out what's going on.
Yeah.
So I think that is like my number one thing. And it's the lowest barrier to entry. It's free.
Right.
It's not like go hire somebody. It is just take some time for yourself.
It's what we need to hear. And that 5 minutes can sound like, what's that going to do? What's that going to do? It's forming the precedent for you being alone, having the space. Even if you're just like breathing and noticing your body, noticing your emotions. That is a skill that we don't do enough of in general. Probably most humans, but especially us who've been taught to ignore our bodies and our thoughts and our feelings.
Yeah.
It's the place that we start. And small, steady things that we can do over and over again are the things that are going to make the difference.
Yes. And as you say, it's really building the foundation for motherhood ahead, right? So if you start doing these things as early as a couple months postpartum, you're going to set a precedent for the rest of your journey. And, that's why when I speak, so many moms with older children like yourself are like, oh, it resonates so much. It's because it's the same issues, right? That you can't get time for yourself and all those things. And it seems radical because in postpartum, you just had this baby, you literally are giving of yourself if you decide to breastfeed, or even if you had the baby from your body, you are giving of yourself. So to say, take some of it back, take it, it may seem kind of, radical, but just think of it as setting that foundation for the rest of your journey as a mother. And it's important.
And that just makes me think too, and I'll just add this as the mom of kids who are a little bit older than yours. When you are used to doing that when they are young, it will be less hard to do that when they are older and they protest and they go, oh, but aren't you going to do this with me? Because that's normal. And so many of the people that I talk to, feel like, well, if my kid's complaining or my kid's unhappy or my kid's bored, my job is to entertain them. And, I think I definitely advocate for quality time, let's have quality time because we probably don't have quantity time kids, with our jobs being as they are. But if you don't start seeing your time for yourself as being important, from wherever you start, no matter how old your kids are, you won't make progress because there's always going to be someone else wanting your time.
Yep.
Even if, the baby's crying, as long as the baby's in a safe place or, that's okay. Baby can cry. Even if your kids are, pounding on the door, driving you crazy, still, learning that, mom takes time for herself.
Yes.
Or important, even if they don't like it.
And it's going to set a precedent for them as well and their relationships going forward.
Right.
For young women, you see that women take breaks even when they're a mother. And for young men, this is okay for my wife to take breaks and to take care of herself. Yeah. And, my caveat, of course, we speak in heteronormative terms, but all inclusive to all people. But those things are important for your children as well. It's not just for you.
Right. And they can protest all they want now, right? Later, they will appreciate it. Because you and I have both certainly encountered, women who've grown up seeing their moms sacrifice. And that was me too. Hi, Mom. Love you. Seeing the women in their family often, sacrificing, putting it all out there, working so hard and taking very little for themselves. And we know the impression that leaves on us.
Yeah.
if we want differently for our children, we're going to have to be the ones who take that brave step to do it, even though it's uncomfortable at the time.
Yeah.
Yeah.
Yeah. You have to set the example. And, I still see in, our Facebook groups and things like that, people talk about, they just have 18 summers or they'll wait to travel until the kids are out of the house. And it's like you mentioned with the quality of time. I'm not advocating to not spend time with your children. And the little bit of time you have should be high quality, no phone, or all of that. But this idea that you have to put your life completely on hold until house, I can't get behind that. I just can't.
I'm with you. Other opinions, that's okay.
Yeah. Yes.
All right. Well, tell anyone who's listening and, is wondering how to get in touch with you, wondering, kind of what support you can give them. How can people find you?
Yeah, really am passionate about revolutionizing this postpartum journey for physician moms. And in that period where you're postpartum, beyond postpartum, any young child, and you have that feeling of anxiety, resentment, you may actually be happy or you may be struggling, but you can always be better. You could be more confident, more joyful. I really am passionate about helping women in that stage just improve their lives. And if you are interested in working with me to achieve that, you can go to my website, Dr. Toya Coaching. So it's DRTOYA coaching.com, and schedule a call. Let's talk about how we can work together. And I would love to hear from you.
We'll have links to that in the show notes, make it really easy for people to find you.
Yeah.
The famous Dr. Toya, thank you so much. For anybody who doesn't follow her on social media, please start following her. You can learn all kinds of important gems, medical and otherwise.
Yes. Oh, I didn't mention my social media. So yes, follow me on all the places. So if you want OBGYN advice, Dr. Toya OBGYN. If you want to hear more, you're still not sure about this whole motherhood thing, follow me on Dr. Toya MD or on Facebook, Latoya Lucia Sampson. I will convince you. I will convince you to take time alone. I will convince you to take a vacation with your partner by yourself. Just give me time.
Awesome. Well, thank you so much for joining us again. And lovely to see you as always.
Thank you so much for having me. It is a pleasure as always.
All right, my friends. Well, thank you so much as always for tuning in. And until next week, we'll see you. Bye.